Time for Health. I'm Rachel Fall, your host, and every time we meet, we talk about a different health topic. Hopefully it's useful for you, or you can share the information with people you know and love. And I have a repeat guest here today, Trevor Johnson from the D.A.R.T program. And you were here, we were kind of talking before we started taping back in 2020, before everything went a little haywire there.
Sure did.
So thank you for coming back.
Thank you for having me.
Just talk about the D.A.R.T program and how it started and what it's about.
So the D.A.R.T program started in August of 2017, and Prosecutor James Van Herten, he knew there was this huge problem with the opiate epidemic, and we had to do something, and he brought me on board to start this program to respond to people that are suffering in crisis with addiction, and we also respond to overdoses, the scenes, the hospitals, and we try to intervene immediately because you have to strike when the iron's hot and to get people the resources that they need.
Gotcha. So it's been going since 2017.
2017, we've been going strong, and we've definitely been making differences in the community. We make differences in individuals' lives, but it doesn't seem to make a dent at a global level, but there's plenty of people that their worlds are better because of what we're doing.
So how do you get involved, like with a 911 call, you get dispatched with that?
Right,
or? Okay.
So we coordinated with Sheriff Steve Lavorchek to let us be dispatched through his communication center.
Okay.
So 911 call comes in, somebody makes a phone call, they get an ambulance, they get police, and then the D.A.R.T team is also dispatched if they know at that time that it's an overdose. Sometimes they don't know until first responders arrive on scene, and then they'll call me later. I don't make it to every scene because I live in Port Clinton.
Yeah.
I have a partner named Bill Marshall that covers the West End, and he handles Oak Harbor West. I handle Oak Harbor East, and we try to make it work best we can. But if we can't get to the scene, we meet people at the hospital and we try to link people up. We try to be as 24/7 and as covered as we possibly can. But with two guys covering a lot of area, it doesn't always work. But we make contact with 100% of the people that overdose in our county, and we're probably around the 80 to 85% of people that we actually make it to the hospital or to the scenes for, which that's a number I'm very proud of.
Absolutely.
Because that's a big deal.
And I think, like you said, it's important to strike while the iron's hot. When somebody is in a crisis, perhaps has hit some sort of rock bottom or something, and they're, okay, what are those resources? Because maybe the next day or in a week, maybe, I'm fine.
That's exactly what happens. You have to look at recovery as a comprehensive approach. I came up with this idea of a bicycle wheel that has spokes. Somebody that is an addict that is trying to put it together, they might have a buddy to crash with, which isn't a very good spoke. They might have just a day or two of sobriety under their belt, which isn't a very good spoke. And then they probably have Medicaid and the medical side of things, so that's a good spoke. But when you try to ride a bicycle with three wheels, it's going to crash. But if you put good, meaningful spokes into that wheel, like mental health counseling, mental health medication, chemical dependency counseling, 12-step programming with AA and NA, positive people, places, and things, good peer support, case management, because every case is extremely different. You could have somebody that has a good living situation, but just a very toxic lifestyle, or you might have somebody that is couch surfing and has absolutely nothing but the clothes on their back. So as many resources that you can get into these people, the more likely they're going to succeed, the more likely that the other spokes are going to help keep that bicycle wheel intact. But the only thing that keeps a bicycle moving is them pedaling it. You can lead a horse to water, but you can't make it drink. So the bike analogy might be cheesy, but
no, I think it's pretty effective.
It fits.
You're putting strong spokes in everybody's wheels and helping encourage them to keep pedaling.
Right.
Everybody to get a little bit of success along.
We all have spokes in our lives, whether we look at it that way or not. The spokes that make us what we are, they need those same spokes. They need the positive things. And the broken spokes of addiction leaves just carnage and tragedy in the wake. We try to repair those family spokes, the friend spokes, those aren't burnt bridges necessarily forever, we hope.
Right.
And let's try to repair some of the spokes.
Yeah. So what are you seeing now?
Unfortunately, we're seeing the highest amount of overdose deaths that we've ever experienced in Ottawa County. We've got a county of about 40,000 people, and we're at 11 deaths. I say it with hesitation because
Confirmed.
we're still waiting on
Yeah.
some autopsy results, but it's terrible because these are young people that are dying. We've had them in their 20s, as young as like 25, up to we've had a couple that were like one was 62 and one was at like in her 50s. So it's quite a range,
Yeah.
but people are dying more so now than ever. This is Trevor's opinion, fentanyl. It's fentanyl because the fentanyl is extremely dangerous. It's very potent. There's a difference between hospital setting and medical grade fentanyl, and then there's bad fentanyl. So I want people to understand that there's two grades of fentanyl. So you have no idea what you got, and when somebody is addicted to drugs, using drugs every single day, they're playing Russian roulette. They don't know what's in that little baggie. That powder could be anything from baby formula that they're getting ripped off on, or it could be a scoop of pure fentanyl, because these backyard garage chemists, they have no idea what they're doing and when they're mixing things up. We're seeing overdose cases with fake Percocets. They're M Block Blue, and Percocet is, if you have a name brand Percocet, Perc 30, you can tell the difference of the ones that are actually stamped and pressed inside of somebody's garage. And just recently in Fremont, our agency assisted with Sandusky County and took one of those presses out. Well, that was one local press, which was a big deal that caused local overdoses. But across the border, they're stamping those things out like a factory. So it's
So we're seeing some not great things.
Right.
And since the last time you were here, the world is different.
extremely different.
Everybody had some really challenging times, a lot of
Extremely.
isolation, difficulty connecting with people and with supports. But we're also seeing some good things. I know there's some, a new partnership with Mental Health Board. Talk about some of the good things and the resources that
So
we've got
one of the
going on.
greatest courses that our Ottawa County Commissioners and our County Administrator set us on a course of success is by partnering with the Wyandotte, Seneca, Sandusky County, and now Ottawa County Mental Health and Recovery Board. They are fantastic. They're extremely receptive. And what people really need to know is that the money that is generated in Ottawa County stays
Serves Ottawa
in
County.
Ottawa County, and that is absolutely paramount. I'm extremely grateful for that relationship and their support and their creativity. So
Right.
we're
Willing to,
their
okay,
willingness
let's
to
try this,
participate.
Let's do this.
They're at our prevention coalition meetings. They really genuinely care, and it feels good. So nothing but great things on the horizon from that newly formed partnership with them.
Now you mentioned the Prevention Coalition.
Yes.
Talk about that.
So the Ottawa County Prevention Coalition, it's housed out of the Ottawa County Health Department. We have a great thing going there. Michelle Velez is the coordinator for that program, and we're trying to get all of our resources huddled together. We have great individual cogs in this machine that were spinning by themselves, but it's amazing how much better everything flows when you get that machine working all together. And at the table, instead of everybody working on the problem separately, we bring it to the table and we can work on it from everybody's individual angle, and we're making some great strides. We spend a lot of time in the schools, at all schools. We're in every school in Ottawa County, and we're trying to get the word out. The Prevention Coalition is focusing on, typically addiction and mental health, but there's so much that can come out of this. So it's not in its infancy, but definitely in an early stage. But nothing but great things on the horizon there, with the support and backing of the Mental Health and Recovery Board.
I participate in that group. So I just love seeing all the people who provide all the resources. I'm trying to think of all the, like the DEA guy is there, the some school representation, the coroner's office, you guys.
We've got agencies, the mental health and chemical dependency agencies. We've got job and family services at the table in different branches of their organization. So it's really neat to see all of those. There's a lot of heavy hitters in Ottawa County at the table that those are the leaders in their field, and those are the people that need to be at the table. And it's paramount to working towards the greater good, and that shows their commitment to working through this problem. And I think that is especially because every single agency is affected by it. The hospital's affected, the law enforcement's affected, the children's services is absolutely affected by the destruction of addiction. So
is that kind of where you gather your knowledge of all the resources, so that when you come to somebody's house where 911 has been called, you're like, okay, I've got all these tools, this is what, we need to do this, and we need to connect with this, that kind of stuff.
It's where definitely I have, it's kind of my bat belt of tools that we have there. And we're always developing new resources. This is, you are always trying to position your chess pieces in a position of success. So we're always exploring new options, more efficient, more effective. Some of it's trial and error, and it's sometimes it's nothing better than that. But I'm no spring chicken, and I've been around a long time and worked in the court system, and I've developed a lot of great partnerships and friendships along the way that really help us get people the help they need right away.
Yeah.
So that it's really, Ottawa County is a really neat place to live because it's small enough to where you can make a phone call and get people help readily.
Quickly. What do you want? What can we do? What can the rest of us do? Or what do you think would be helpful? Like if somebody's watching this, pay attention, take note of things, pay attention to things.
Well, if you're already watching this, you're educating yourself. And number one is educating yourself. You have to learn more. You can't believe everything that you read in the news. And I challenge you to not only take my position, learn my position of trying to learn more about it, but learn from other people, learn from people in addiction. If you've never walked in those shoes, you have no idea what it's like. So, research it, do your homework on this and form your own opinions. But we need to start talking to our kids. We have got to start talking to our kids about peer pressure.
I feel like we think, I don't want to introduce that, but I feel like.
Well, I'm going to tell you that kids are a blank slate. Imagine a fresh piece of paper, and every day they're learning, and every day they're filling in the blanks. So they're going to fill in their blanks somewhere, and you're going to want to be the one that fills the blanks in with good, meaningful information, and instead of somebody teaching them the wrong way.
Without their best interest in heart.
Absolutely. Somebody that's just messing with them, somebody that, we joke about, you put your kid on the bus and they come home with new words. It's kind of something similar to that, but you have to talk to them about that. And we need to talk about mental health. We need to talk about mental health because there's so many people struggling with depression and confidence issues, and just fitting in and bullying. Like there's so many things that we need to give our children the power to have the confidence, one, to even take that one step to reach out and talk to somebody, talk to the professional to get help. If you have a broken car, you can't just leave it in the driveway and expect it to fix itself.
Right.
It's not going to happen.
Right.
You have to get that car to somebody that knows how to fix it. So in this case, we want the parents, we want the students. You've got to reach out to the counselors, reach out to the adults that know how to link you to the treatment. There's a lot of people there.
There's a lot of resources out there.
Right.
Yeah. All right. Thank you very much.
Thank
Any
you.
last minute thoughts?
Be compassionate. be kind. You never know what somebody's day is going like. You don't know what their world is, and just remember that there's other people, in this world, and not just you.
Yeah.
So be thoughtful, be mindful, and stay in your lane.
Right. Thank you. All right. Another awesome episode, learning a lot of information, kind of some tough information. Things are a little rough out there, all over the place for so many different reasons, but there is hope, there is resources, there are good, wonderful, good trained people out there that can help. So again, whether the information is helpful for you or for somebody you know and love, please pass it on and help connect people to the services that they need. And until we meet again, I encourage you to make time for health.